So let's say that you came into your consultation, you've decided that yes, the 3-on-6 treatment is for me, you want to move forward. You had your records appointment, the next step is surgery or the big day, right? So what does the surgery look like? Each surgery is typically about 4 to 8 hours. Can we guarantee how long it's going to be? The answer is no. It's a little complicated. We're doing lots of implants, typically lots of extractions, lots of suturing, soft tissue management, bone grafts. There's a lot that goes into it. So what I tell my patients and the person that's with them that day is I'm going to give them as much time as it requires to get the job done correctly. So sometimes the surgeries can be pretty quick. They can go 4 or 5 hours. Sometimes they aren't. Sometimes they can be 8, 9. I've even had 10 and 11-hour surgeries. So these can be pretty extensive. So it's important to know that going in. The most important thing for the day is that it gets done correct, and we're going to take as much time as necessary to do that. So when you're sedated, you are intubated. That means a tube is going down your nose and down your throat. It can't go down your mouth because we need to work inside of your mouth. So it's normal for a patient's nose to be a little bit sore, down their throat to be a little bit sore. All those things are a normal part of being sedated. So how do you prepare for surgery? Obviously, you have to come in fasting. That means nothing to eat or drink, including water, for a minimum of 8 hours. So in my office, we start surgeries typically at 6:30 or 7 o'clock in the morning, which means the patient can't have anything to eat or drink after 11 o'clock the night before. We tell you to wear something super comfortable, shorts, a nice loose-fitting t-shirt, and of course slip-on shoes. All those things will help you be more comfortable on surgery day and as you're getting back out to your car. Another thing that you'll be doing is wearing an adult brief, an adult diaper, right? Something like a Depends. Now, do we need to use this every time? No, but on the outside chance that you're going to have an accident, we want to have it inside of that diaper. So the staff will help you put one of those on the morning of your surgery as well. And also compression socks. We're going to give you a pair of compression socks you're going to wear throughout the procedure and on the way home, especially my patients that are driving long distances or they've flown into town. We'll talk about all the other things that you need to be aware of when you're traveling. So the actual surgery can be a variable time length, and the staff will communicate with you throughout the day. They'll communicate with your care provider and give them updates as to how things are going. Does your person need to sit here in the office the entire time? The answer is no. We encourage them to go home, go run errands, go do something else besides just sit in our waiting room. Now we have a very nice waiting room. We have some nice comfortable couches. They're welcome to sit here if they'd like, but that's a long time to be sitting there worried about what's happening with your patient in the back. So we encourage them to get out and go do something else. They can go get your prescriptions filled. They can pick up stuff to help you recover. That's a good time to do some of those things. So anyway, that's some highlights about surgery. It's also really important to get really hydrated the day before. So obviously before 11 p.m., we want you drinking lots of fluid to get hydrated. And you will get a call from a sedation provider, typically 2 to 3 days before your surgery, to go over your health with you and, of course, answer any questions you might have specifically about your sedation.